This is obviously a severe chest wall injury with a flail segment with paradoxical wall motion. What are your primary concerns with this patient, and how are you going to manage this patient? This was a severe mechanism of injury, so there's some concerns we're going to have, such as pneumothorax, tension pneumothorax, hemothorax, respiratory insufficiency, and unmanaged pain. We want to take care of life threats and confounders to management before anything else. As far as management of the patient, it's entirely dependent on whether this patient is ventilating adequately, whether they are oxygenating adequately, and how much effort they are putting into that ventilation and that oxygenation. If they are ventilating adequately, if they're oxygenating adequately, if the effort isn't too much, we're going to support that effort with supplemental oxygen and pain management. But if they're not ventilating adequately, if they're working too hard to ventilate or oxygenate, then we want to provide assisted ventilations with a bag valve mask and possibly intubate this patient. And we want to splint this patient from the inside out. This isn't 1979. We're not going to put sandbags on this patient. We're going to splint it with positive pressure ventilation. And don't forget pain management. This patient has multiple bone fractures that are rubbing against each other. And the lining of the bone, which is called the periosteum, has some of the most sensitive pain sensors in the body. And there's repeated incidental contact happening with every single breath. So manage that pain. It is a form of instability to be in unmanaged pain. So fentanyl, ketamine, whatever you got, just keep an eye on their ventilations and their oxygen saturation after you give them that pain control.